Hello, I'm Dr. Dennis McKenna, joined again today by Dr. Venditti, our hospital director, giving you the update from Albany Med on the coronavirus. Today, Albany County is reporting in the county 127 patients who are positive for COVID-19. Here inside the medical center, that's translating into 6 patients currently in the hospital. We've also seen and discharged 5. Those 6 patients are split 3 on the floor and 3 in the ICU. Those are numbers similar to yesterday. We still have an adequate number of rooms and ICU rooms and ventilators and staff to care for all the populations we have here today. Fred, you normally give us an update on PPE.
So the PPE status is good. We have adequate numbers of everything, masks, gowns, etc. I do want to, though, talk about something that's been going on that I think will be helpful for the staff. At South Clinical today, one of the infection protectionists went over to talk to the staff about appropriate use of PPE. And I think that's valuable for 2 reasons: to have the staff use the equipment appropriately to protect themselves and the patients, but also to decrease the use that might not necessarily help. So she met with 24 staff members, half of whom were masked. At the end of a short education, the one appropriate person that needed to remain masked was masked. And I have to tell you, Dennis, I heard they were very happy about the education. One of the staff members was actually crying. She was so relieved to know the appropriate thing to do now. So we're going to continue to do this to help better manage our PPE.
So these videos are helpful, but actually having our staff deploy right to the front lines and educate is also an added benefit.
I think there's nothing like face-to-face education.
That's great. Thank you for that. Our evaluation tent continues to be up and running. Yesterday we saw 31 people in there, and that again is an opportunity for people in the community who wish to come and be evaluated. For our own workforce, as I mentioned, we have expanded the employee health service hours from 7 a.m. to 7 p.m., now 7 days a week. In addition to that, starting tomorrow night, we're going to have an on-campus presence from 7 p.m. to 7 a.m. So for all intents and purposes, 24 hours a day for employee health service for people to come and get checked out if they have any concerns about fever, cough, or unexplained shortness of breath.
So Dennis, I think some of our staff have noticed the nurses at the entrances. Tell us what that's about.
So thank you to our logistics team as part of Incident Command. A couple days ago, Dr. Venditti had said we need to get this out and we need to get this started. And very quickly, they've been able to take resources and deploy them to all our different areas of the hospital where people come in. And they'll do symptom monitoring, including the opportunity to get your temperature checked. And that is something that not everyone has the opportunity to do because not everyone works in a clinical area with a thermometer. So this is one more opportunity to screen our workforce to make sure that they're coming to work and they're not sick.
That's
which is great. And so we encourage you, please stop at the desk, thank them, and get your temperature checked. HR today put out a video with leadership from the hospital to talk about issues specifically related to employment, including things such as symptom monitoring and benefits and leave during this period. So I encourage you, please, to look for that video online, and I think that's going to answer a lot of questions that members of our workforce have related to COVID-19. Fred, yesterday you spoke about the submission to the state for our surge plan, and you mentioned there was 5 tiers. And could you please tell us what tier are we now and where are we with that plan?
So the plan has really come together quite nicely. The group working on it in Incident Command has done a tremendous job. So today, Dennis, we're in Tier 1, which is sort of the starting place for what we expect perhaps we'll see in terms of growth. There are 5 tiers. The 5th tier actually gets us to the 50% growth in capacity that the governor's been asking us for. So we're right on path. We'll be able to submit that plan later this afternoon as required by DOH.
That's great. In addition, you and I participated in a press conference today. I think that will also be available for people to see online. That was with our hospital and other area hospitals as well.
That's right, Dennis. And our surge plan, we've obviously been doing a lot of work internally. The other hospitals have been doing the same thing, and we've agreed we're going to share our plans, try to learn from each other, and frankly have a coordinated response across the community, which I think will be good.
Thank you. We'd like to thank the staff on C2 for these shirts today. We're obviously looking for the opportunity to thank all of you for the work you do, and this is a special unit that takes care of a special patient population. We thank all of you for everything you're doing. We ask you to take care of yourself. We ask you to take care of each other, and we'll see you tomorrow.